All right, Scouts, we're going to go ahead and start talking a little bit about the basics of first aid. The first thing we want to talk about are the three C's of first aid: check, call, and care. When we say check, we want to make sure that the area is safe for you and safe for the victim. Also, tap the victim on the shoulder and ask them, are you okay? If you're sure that the scene is safe, begin to understand what's happened. If you need to call for help, call for 911 or send someone to get help. Only after you've determined that it's safe for you and safe for the victim and called for help should you begin applying first aid. So the three C's again are check, call, and care. Make sure that the scene is safe for you, call for help, and begin providing care. The first medical emergency that we're going to discuss tonight is something called shock. Shock is when the body doesn't circulate enough blood to all parts of the body, so your organs, your heart, your brain, things like that. The victim may start to turn pale, they may feel a little weak or tired, their skin could be cold and clammy, they may even shiver or vomit. Shock can be very serious if it's left untreated, and typically would accompany a very serious injury. Don't wait for the symptoms of shock, what we just talked about above, to appear. You want to treat anyone that's badly injured for shock, whether or not they're starting to display the symptoms at that time. Again, let me repeat this. If you're assisting someone that is badly injured, whether or not they're displaying these symptoms of shock, you want to go ahead and treat them for shock and wait for professional medical help to arrive. So how do we treat for shock? The first thing is to call 911. Shock is a medical emergency, and you must get medical professionals there to help as quickly as possible. You're going to have the individual lie down on his or her back, get them relatively comfortable, and if there's no bodily injuries, they don't have, a broken leg or anything like that, you can raise their feet slightly. This is going to help the blood flow to the critical organs. If they're unconscious, and again, they don't have any bodily injuries, you can turn them on their side. Keep in mind that one of the symptoms of shock could be shivering or even vomiting. And if they vomit, you don't want them lying on their back. You want them to be lying on their side. If it's a little cold or chilly out, you can put a blanket over them. Otherwise, you're going to help try to keep them calm and wait for professional help to arrive. So again, shock is a very serious medical condition, typically accompanies a significant bodily injury. This is when the body is not really circulating blood to all of the major organs. You're just going to have the individual lie down on their back, raise their feet slightly, and cover them with a blanket if it's cool, and try to help keep them calm until help arrives. Now, let's go into some other medical conditions. Let's start with just basic cuts and scratches. If you're going to be helping treat cuts and scratch, you certainly want to wear some gloves and maybe even some eye protection. You're going to wash the wound with a little bit of soap and water and put a bandage over it to cover it. This could be a Band-Aid, could be gauze, depends on how large it is. If the wound is bleeding a lot, apply some pressure to it to stop the bleeding. Once it's stopped, then you clean it and bandage it as you would any other injury. Whether it's your injury or somebody else's, even if you're wearing gloves, you absolutely want to wash your hands after treating a wound. Okay, so cuts and scratches, pretty straightforward. Wash it with soap and water. Make sure you're wearing some gloves while you're doing it. If it's continuing to bleed and not really stopping, you can apply some pressure to it. And then when you're done, put a bandage on it, wash your hands, and it will begin to heal over time. Now let's move on to something that's a little bit more serious than just a basic cut or scratch. There's also something called severe bleeding. So what is severe bleeding? This is when blood is gushing or spurting out of a wound. This is a very, very serious medical emergency and requires medical attention immediately. The bleeding has to be stopped. So how do we treat for severe bleeding? Well, first and foremost, we're going to get help. For severe bleeding, you always, always have to call 911. You want to wear gloves and eye protection to keep the blood off of your hands and out of your eyes. In order to stop the bleeding, we're going to put pressure on the wound and push a cloth or pad onto it. You can see in the video here in the top right that you apply pressure to that wound, you put a cloth on it, and if you can wrap something around the wound and raise it above the victim's heart. Scout neckerchiefs are great when you're out in the field, if you're on a hike or camping trip, to use to help wrap wounds if that's what's necessary. Don't worry about damaging it or ruining it or anything like that. Helping someone with their first aid is far more important than a neckerchief. You can also use shirts and other items that you have around, whatever's handy to help stop the bleeding and keep pressure on it. The most important aspect of stopping severe bleeding is to apply and maintain pressure on the wound to stop the blood from flowing. Now let's talk a little bit about burns and scalds. There's three types of burns. First and foremost is a first-degree burn. This is when your skin gets a little red, feels like it's burning a little bit, and it gets sore. Many of you have probably had this kind of burn before. The next one is called a second-degree burn. This is when it's a kind of a red around the skin, but you get blisters on the actual burn site itself. And then finally, a third-degree burn. This is when the skin itself may be burned away or charred. This is a very serious medical emergency, and you need to call 911 for third-degree burns. In order to treat burns, for a first-degree burn, you're going to put the burned area in cold water. Cover it with clean, dry, and a loose bandage, and it's going to heal on its own relatively well. For a second-degree burn, put the burned area in cold water, and then you're going to put a sterile pad and hold it in place with a loose bandage. You don't want it to be too tight on it because that could actually irritate and damage the blister. The blister is going to help the burn heal a little bit, and it's really important that we don't use any creams, ointments, or sprays with second-degree burns. With a second-degree burn, it's possible that you may need to treat for shock. For a third-degree burn, you definitely want to call 911. This is a medical emergency. You can cover them with a clean sheet, but do not put it under cold water. Do not try to remove any clothing or anything like that. Treat for shock if necessary, and wait for professional help. Otherwise, do not treat the wound itself. Allow the medical professionals to apply the first aid to a third-degree burn. All right, Webelos, so this is our first foray into first aid. I hope you learned a little something from this. Our next video is going to have some more medical conditions that we're going to learn how to treat.